Welcome to the Beverly Hills Plastic Surgery Podcast. Today, I am here with my unruptured colleague and associate, Dr. Millicent Rovelo. How are you doing?
Good. I'm doing really well. I'm very glad that I'm not ruptured because I do not want to be the topic of this podcast, which is ruptured breast implants and what to do about them.
And this happens.
Oh, yeah, it definitely happens. I mean, it's a big part of revision breast surgery is ruptured implants. So let's talk about that. There are a couple different ways implants can rupture. So we're talking about breast implants, obviously.
Filled with either silicone or saline.
Or saline, because they come in either variety. If you have a saline implant, that means it has a silicone shell on the outside and it's filled with saline fluid on the inside. If that implant ruptures, it is not subtle. It is here today, gone tomorrow. It is a surgical emergency. That's an immediate call to your plastic surgeon of like, help, because I'm very lopsided. Now, to be fair, sometimes you can't tell if you have very large breasts or they're hanging very low on your chest and there's a lot of skin. Sometimes these things can go undetected. But in general, if they were otherwise looking pretty darn good one day and then one day one of them is not, then yes, you have a ruptured saline implant. It's not that hard to diagnose.
And it's not really an emergency.
I mean,
I know it is because you're down like you got a flat tire on one side.
Yes.
It's terrible.
No, it's not a medical emergency. No. It is an aesthetic emergency to the patient because now they are lopsided.
Absolutely, it's a clothing couture.
Yes,
emergency.
Disaster. Yes,
it's a how am I going to wear this dress tonight?
Yeah,
disaster.
We've all gotten that phone call. Help!
I know, totally. In fact, the reason we're talking about is I got one on Monday that was like 10 in the morning, like, there's a problem with my breast implant. And so patient came in that day and I was like, so with a saline breast implant, you should address it sooner rather than later.
Right.
But you can leave it in for good.
You can leave it in forever. It's fine. But if you want to look symmetric, you should probably get that addressed. So that's an obvious one. But if you have silicone implants, silicone implants have a silicone shell, silicone on the inside, you are not going to know by looking at your breast if it has ruptured because the silicone doesn't go anywhere. It's not like saline, which gets absorbed into your body. The silicone doesn't get absorbed, so it still stays there and retains its volume. So you wouldn't necessarily know just by looking at it if it has ruptured. This is why FDA recommendations say that you should get your implants imaged starting at about 5 years, either with an ultrasound or an MRI, and every 2 to 3 years thereafter, because that's sort of the only way to tell if the implant, a silicone implant, has ruptured. Do people actually follow those? No. And I think we've talked about this on other podcasts before. That's up to your discretion. But if that is of a concern to you, that is how you would diagnose it. But let's go back a bit and talk about the types of implants, the age of the implants, and what happens when they rupture. So implants back in the day, back in the 80s and 90s, those were very prone to rupture.
Yes.
Those would rupture 5, 6, 8, 10 years after placements, which is why the FDA initially recommended that you get your implants swapped out after 10 years, which has now just become sort of like plastic surgery lore. Oh, I've had my implants for 10 years. I need to have them swapped out. Well, that was based on old, data, which show that, about 10 years, these implants would rupture. Let's swap them out before they do that. Current generation of implants have 20-year warranties against rupture. That's how long the implant companies believe they should last for before they rupture. Most people end up having their implants swapped out before 20 years for aesthetic reasons. Size changes, time, age, gravity, children, pregnancy, things happen to the breasts and they want to upgrade them, change them out, but not necessarily because the implant itself has failed.
Yeah, and that's the 20 years, should you get them swapped out before 20 years? It makes sense that you should, but I think it's just that they won't do anything if they won't warranty them after 20 years. So that means that they could still last longer.
They might.
And you can get MRIs and check if you really are concerned. And that's the only, and by the way, MRI to me is pseudo-reliable.